Hi, Sean Thomson here from Australian Imaging. Today we're looking at the KaVo OP3D. We're at Orchard Dental in Sydney's northwest outskirts, where Dr. Isidoro Filito has been using this particular model for just over a year. So we thought we'd have a quick look at the system. This system is set up as a 3-in-1 unit, so it can take OPG, lateral ceph and cone beam CT in the one compact system. Let's just swing around here and have a quick look. We've got an example of a panoramic image here from a child. So this one is a 9-second scan at 67 KV, low dose, an example of our lateral ceph imaging. Let's just move that down into the corner. As you can see here, the soft tissue detail is extraordinary. Okay, so let's go in and have a look at the operation of the system. So a lot of systems will operate from the actual side of the system. The OP3D has a graphic user interface which is on the PC, allowing very quick and easy adaptation of what modality we're going to be taking. So at the moment we've got it set up to take a panoramic. This is our adult panoramic, our child panoramic. Does a really nice bite wing program, which is a 2D bite wing program. It's only a 6.4 second scan time. It does a left and a right side. Our TMJs, and if we were going to be taking a lateral ceph, this modality will come up, allowing us to select adult, child, PA or carpus. If we were taking a lateral ceph for a child, you can see that we miss the cranial area, the soft tissue area, and we can then change the actual field of view for kids to reduce the actual exposure, and we can then go back out. If we've got an adult, we can do the same thing. So we're just reducing what we can see, exposing the patient to a much lower dose. On this particular unit, we've also got our 3D mode. So we can go in and select any teeth we want to see, or we can select the whole region. So there, all the area in green, which is the maxilla, we can highlight that, or we can go in and highlight just the teeth we want to see, and it will collimate to a field of view that's suitable to view those particular teeth. Here's an example of a smaller field of view. So it looks like a 5x5, and we're taking a 5x5 is looking at a smaller structure here in high resolution. So you can see here, we can move this around. From an image quality point of view, the images are really nice. So with this particular unit, we're going to go back to our interface. Okay, we've got our interface here. We'll get out of this screen. We'll reserve the scanner. And we'll select our ceph. We're going to take an adult ceph, and let's go over to the system. This is the only system in the marketplace with a dedicated X-ray source for lateral ceph imaging. And what that means is that we don't need to interchange the sensor from pan to ceph or purchase an additional second sensor. So if we're going to take a lateral ceph now, the system is in a position to take an OPG. The head will now move around into the lateral ceph area. At the same height, we've taken an OPG, so really good for those practices that are doing a lot of ortho. You don't need to adjust the height, so whatever height you take the OPG at, that will be the height the lateral ceph is taken at. A really great system. Come and chat.